On this edition of the Scott Radley Show podcast, we are talking about healthcare. Is it time, considering how the current system is struggling, is it time to begin seriously considering privatization of some facets of our healthcare system? I know it's sacrilege, but we're going to talk about it.
Today on the Scott Radley Show on 900 CHML.
So we are now hearing that tens of thousands of surgeries and other medical procedures are being put off. Other medical services are being delayed because our system is overburdened. This isn't new. It's just a reminder. It's been going on for some time now. Back in November, the Canadian Medical Association wrote that 4,000 people have died in this country, roughly, as a result of canceled or delayed healthcare services. I don't know where those numbers come from, but the Canadian Medical Association says so. We'll give it some credence. So we could say, okay, government, it's on you. Make this better. Spend more. Fix the system. This is time to fix our healthcare system. But that's going to cost billions and billions of more dollars at a time that we are already swimming in debt. And I'm not sure that simply throwing more money at this automatically fixes it. Plus, we have every other sector of society screaming for billions and hundreds of millions of dollars to be fixed as well. So the question becomes, COVID is not going to last forever, clearly. The healthcare system is not going to be facing the same challenges it is now, clearly. But we are seeing that our healthcare sector has problems, has weaknesses, and not just in Ontario, across the country. So is it time to do what many people have been rejecting forever as almost can't even talk about this. It's a sacred, it's offensive to even talk about this. Is it time to consider some privatization? Is it time to consider some private healthcare? Well, a survey that was done last month says, you know what? People are actually starting to warm to this concept. Leger found 62% of Canadians now think it would be okay to spend for people to allow people to spend their own money to get healthcare. This poll was sponsored by secondstreet.org. Their president, Colin Craig, joins me now. Colin, how are you today? Thanks for doing this.
Well, thanks for having me, Scott.
You know, as I say in bringing you in here, considering that public health care and non-privatization has been really almost a sacred cow for decades in this country, are you surprised to see those numbers creeping up and approaching almost 2/3 who are at least willing to consider it?
You know, I don't think the numbers are too surprising when you think about what's happened. We've had decades of fear-mongering in this country when it comes to healthcare debate. Inevitably, the discussion has been, well, either we have Canada's system or the U.S.'s system. This is what opponents who don't want to see any kind of reform because they have their own special interest needs, they will say, well, these are your only choices. And over time, I think more and more Canadians have understood that there's 200 countries on the planet. There's lots of other systems that are providing better health care, and they use a mix between having a public system and a private system. So I think Canadians are kind of warming to this issue. I think they understand there's ways that we can preserve what I think just about every Canadian loves about our system, and that is that everyone's covered, no one's left behind. They like that universal concept, but we can also take that step where we say to people, look, if you don't want to use the public system, you can pay out of pocket at private clinics and maybe get some different services.
But isn't that by definition then going to say, well, if you're rich, you're going to have better health care than if you're poor?
I don't think so, no. And we've actually been talking to a lot of Canadians for the past couple of years now, especially cases where people have gone to other countries for health care. And these are people from all walks of life. There's a lot of, obviously the wealthy, if they're facing a year or 2 year wait for an important health procedure in Canada, they're not going to wait for it. In most cases, they have the money, they're going to go abroad, they're going to get the best service they can. But we've talked to countless middle-income people, everyday people, a nurse from Nova Scotia, an education assistant here in Alberta. You know, lots of people from all kinds of walks of life. They're in pain, they're desperate, they're suffering. They're going to scrape together the money to go abroad, and they're suffering to improve their quality of life. They want their lives back in many cases. That's what we kept hearing again and again and again from patients. I want my life back. And that's what these options allow for them.
See, the argument that that you hear it anyway, that is given for the let's do some privatization side is, well, if let's say Colin decides he's going to spend $20,000 to pay for surgery to get a procedure done. That takes Colin out of the line, moves everyone who doesn't want to pay their own money up a little closer to the front of the line. So we would peel out a whole bunch of the people who are waiting, and we would ease the strain on the public system that is still there. That sounds like a good thing.
Well, that's exactly what would happen. And that's why countries that have healthcare systems that perform better than Canada, that's what they do. Australia, New Zealand, Norway, Sweden. I mean, these are countries where, like I say, they have universal health care like Canada, but they also give patients that choice. And some decide, you know what, it's important to me, I'm going to spend the money. And they leave the public system. And exactly what you said, it shortens the waiting list for everyone else. At the same time, it creates some competition. It leads to innovation because the private clinics might try something a little bit different, and then the public system can learn from that, or vice versa. So that's why these other countries use this model. It doesn't mean that everyone's going to use the private care. In most cases, people will still use the public system. It's just like our public education system across the country. If you're a parent, you can send your kid to a public school, and most parents do. And some parents say, no, you know what, I want some kind of a specialized procedure or education for my child. I'm going to send them to a private school. And so some do that, and it takes pressure off the public system as well.
But when you talk about the competition, isn't that going to drive up the price arguably? Because now if you've got private systems competing with public systems and vice versa to get the best doctors and best nurses, they're going to be able to name their price. They're going to get higher incomes. Therefore, the price of all these procedures for everybody is going to go up.
Well, competition typically leads to lower costs when you have people competing to provide a service. And I think we would find the same in the healthcare system. But I think what's really interesting is that for years we've seen countless medical professionals, whether we're talking about nurses, doctors, surgeons, they graduate in Canada and then they leave. They go to other countries because they can make more money. And if we had private alternatives in Canada, I think we'd see some of those medical professionals decide to stay in Canada. So we'd ultimately see more and more people working in the system. And that would actually be a good thing when pandemics come along, because you need a lot of resources. You need lots of doctors and beds and nurses. And Canada, the numbers show that we trail the developed world when it comes to having those resources on a per capita basis. So when a pandemic comes along, Canada's system is strained and we have fewer beds to treat COVID patients. Well, if we had more private options, then we could see more surgeries proceeding at the same time. And one of the interesting things that governments are doing to try and address their backlogs is they're hiring private clinics to provide surgeries and other procedures for patients. So it's one more way that you can reduce backlogs, is just simply expanding your capacity.
Your survey, your survey, it started with the same two letters, but went on after that. Your survey that you did with Leger a month and a half ago, when it said 62% of Canadians were now open to it, which was up from, I think, 51% not long before. So it's clearly there's an element of COVID and what's going on right now that's factoring into this. Do you not expect then that, let's say 2 months after COVID has faded away and we get back to some kind of normal, do you not expect that the numbers would return to exactly where they were before, that this is merely a momentary blip in time?
I don't think it would. And one of the reasons we have to keep in mind is that there's this huge backlog right now of surgeries, diagnostic scans, appointments with specialists. That's not going away anytime soon. That's going to take years for health systems to address. And not only that, as they're trying to address that, we have an aging population. So demand keeps increasing and increasing and increasing. It's just a fact of life that as we get older, we start to have health problems, whether it's joint problems, problems with their hearts and other organs. So I think that this problem isn't really going to get substantially better anytime soon, unless we see health reform. And there's a lot of different things governments can do. We polled the public on a few of them. A majority of Canadians support these ideas. Like you said, it's up from before the pandemic, the significant jump, 51% to 62%. In Ontario, there was a significant jump too. still a majority of people in Ontario support this option. So I think, we're going to find more and more Canadians getting frustrated about where things are at and clamoring for change.
That is Colin Craig. He is the president of secondstreet.org. You can find more information about this poll there and, have a discussion there if you wish to on their website. Colin, really appreciate the time today. Thank you for this.
Well, thanks a lot for having me, Scott.
You're listening to the Scott Radley Show podcast on 900 CHML.